Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.
This is St. Louis on the Air from St. Louis Public Radio. I'm Elaine Cha.
The result of being a mistaken target or an innocent bystander. There's no code for that.
These kids don't have a story, right? They were sitting at home doing their schoolwork, or they were walking to the bus stop, and they themselves may not know what happened.
None of these needed to happen.
Across the country, people are struggling to understand gun violence. A mass shooting at a Texas mall this week raises familiar, painful questions about access to guns, mental health, and the impact of extremist bigotry. Closer to home, in St. Louis, there were 13 shootings over the weekend. 2 of them happened on Cherokee Street, where many people were celebrating Cinco de Mayo. A nearby shooting wounded 2 people during a festival in the neighborhood the next day. The question many of us have is, why? Why was the trigger pulled? Why did it happen there? And why then? And while these questions are imbued with deep agony when gun violence involves the soundness and safety of children, the pursuit of answers too often leads to nothing that helps. No idea of a shooter, no background on circumstances. Here in St. Louis, doctors and researchers have conducted a new study focused on getting a clearer understanding of gun violence and its child victims. That study, published earlier this month in the Journal of Surgical Research, examined 3 years of medical data at St. Louis Children's Hospital and looked at cases of children who arrived at the emergency department injured by gunfire. And with us now is the lead researcher on that study, Dr. Beth Bernardin. She is an assistant professor of clinical emergency medicine and pediatric emergency medicine at the University of Missouri School of Medicine. She's also an instructor in pediatrics and emergency medicine at Washington University. Dr. Bernardin, welcome to our show.
Thank you so much for having me.
Please tell us about this study, which was conducted at the St. Louis Children's Hospital and involved analyzing the records of 156 children injured by guns during the years between 2014 and 2017.
Yeah, so, unfortunately, we've come to learn that gun violence is the leading cause of death of children in America. And we also know that firearm assaults, or what we call firearm assaults, are the most commonly cited cause of these firearm injuries, more so than accidental shootings or undetermined shootings, from what we can tell. Unfortunately, though, we just don't really understand, what does that mean, firearm assault? Mm-hmm. So what we wanted to do was to dig a little bit deeper into the medical charts of these children who were presenting with firearm injuries to find out what exactly does it mean? What were the circumstances behind these shootings? What caused them? Mm-hmm. There's very, very little research kind of describing further what is meant by firearm assault. Mm-hmm. And what we think we know is a little unclear, and there's a lot of kind of conflicting information. We have been told in other studies that most commonly, when a child is shot, they know their shooter, and that these children are often involved in some sort of conflict between the shooter and the victim.
Right.
But we found actually the complete opposite. Most of the children in our study who were shot outdoors in public places, and most of them did not know who shot them, mm-hmm. and they didn't know why they were shot. So they were almost all coded as being firearm assaults.
I see. So was it something that you were observing in your provision of care that made you realize that this, that it warranted more study, or just some study at all? And how was it that you went about analyzing cases for the study that's part of what's just been released?
Yeah. I think it was unfortunately the frequency with which we were hearing these stories of the children who came in and from their families, and that so frequently we were hearing that they were outside and, either a car rolled by and opened fire into a public place, or that they were outside and they just heard, pop, pop, pop gunshots.
Right.
And the children tried to run, and at some point the child realized they had been hit. And it was just such a frequent story that I just had to understand more. How frequently is that really the case? And because it's astounding how little we know in the medical literature, even though this is supposedly the leading cause of death in American kids.
Right. And just to clarify, when you say children, what ages are we talking about?
Yeah, that is a good question. Yeah, so the children in our study ranged. The youngest was 6 years old. The oldest was 17.
Okay.
The average was around 15 or so.
I see. Now, was it surprising to you, Dr. Bernardin, that most of these kids were just innocent bystanders? That is, they were not hurt by adults in their home being negligent with a pistol or an accidental firing?
Right. Yes and no. I think that it's very unfortunate that we're calling so many of these shootings firearm assaults, because I think that only tells part of the story, and that's not really fair to the victims or to their families, and it doesn't really help us confront the problem of gun violence. Yeah, I think that we need to do a lot better job documenting what really does cause the majority of these shootings, because it's a little bit of a failure on our part that we're not describing them better.
Right.
We can't, I think, make really very good attempts at confronting the problem of gun violence if we don't really know, or at least we're not really documenting the real causes.
I'd like to bring in another voice to this conversation. Dr. Lindsay Clukies is an emergency medicine physician at St. Louis Children's Hospital. She is also an instructor of pediatrics and emergency medicine at Washington University, much as you are. Dr. Clukies, welcome to our show, and thank you for joining us today.
Thanks for having me on.
Now, what was it that has stood out to you about the findings in this study?
I think the biggest thing was that the study was so needed, and I really credit Dr. Bernardin for doing it. As she was mentioning, we need data. We need to better understand these injuries in order to find the solution, in order to prevent these from happening. And when we look at a medical record, we're limited to different types of coding and coding that's needed for billing purposes, and so that doesn't tell the whole picture, but that is oftentimes the best information that we get. And nationally, we oftentimes group these firearm injuries into two categories, either intentional and unintentional. And when people say, an intentional firearm injury, oftentimes that has a violent connotation, and you think of like she was mentioning, you think of intentional assaults and violent type injuries.
Right.
And we know that that's often not the case. So that the children who are caught in the crossfire and may not be the intended targets are often grouped into the intentional injury category. And that can come with stigma, right? So when you think of firearm violence, people think these quote unquote bad children outside doing bad things and purposely, intentionally inducing violence on others. And what Dr. Bernardin's study shows is that that's often not the case. These are often innocent bystanders who suffer injuries because of the circumstances around them and not because they were outside intentionally trying to harm others.
So with these findings then, I mean, you treat children who are injured by by gunfire. Did the findings match your experience? And was there anything in the study that didn't match what you have seen as someone providing care?
I don't think it was. I think from our perspective, the ones who are, in the ER, in the trauma base, seeing these children, it wasn't totally surprising. Mm-hmm. But to be completely honest with you, we go into resuscitation mode. Sometimes we are given no warning when these children come to our ER. They may, be carried in the front door, and we don't ask a lot of questions at that time. Right. We just start resuscitating them to save their lives. That's our primary goal in the emergency room. So oftentimes we don't know the circumstances right away. Mm-hmm. We have amazing social workers who are trained in trauma-informed care, and oftentimes they find out a little bit more about the circumstances. And I don't think it's totally shocking to us. I don't want to speak for Dr. Bernardin, but we've worked together quite often. That oftentimes these kids don't have a story, right? They were sitting at home doing their schoolwork, or they were walking to the bus stop, and they themselves may not know what happened. And I think her study was so important because it really put it on paper, and it really used the data to prove what we know that we've all been seeing.
And why is it important that we understand the circumstances of a shooting?
I think it can help us better target our interventions, right? So as I was saying, we have to get the stigma away from these violent children that are outside, causing a ruckus. That's not the case. And I think in order to separate that connotation, it'll help us better serve these kids and better focus on prevention in order to stop these injuries from happening from the first place.
Mm-hmm. Dr. Bernardin, this study focuses on cases from 2014 to 2017. That's roughly the same time you were studying pediatric emergency medicine at St. Louis Children's Hospital. So conducting this sort of research years later, what is it like knowing that it's likely that you treated some of these children yourself? And I believe that this may also be the case for you, Dr. Clukies.
Yeah, it's a little painful to read their medical charts, to be completely honest. And it was a deep dive into the medical charts, not just the emergency department, but reading the social work notes from when they're hospitalized to get that information. Because like Dr. Clukies said, in the emergency department, a lot of times we don't have enough information about what actually happened, and our focus is to resuscitate the child. Firearm violence is it's a horrible thing to have to witness, especially when it affects a child. Mm-hmm. You can't take care of these injuries without it affecting you. I think all of us that work in the emergency department really understand that. Reading through these charts it's painful, it's sad, because these are preventable injuries. They're completely preventable. The leading cause of death of children, it's not what people would guess. It's not, it's not childhood cancer. It's not congenital heart disease. It's guns, and none of these needed to happen. So I think it's so important that we back up and try to understand what really is the cause of these to begin with, because we have to be better informed in order to confront the problem. And I think it's very important that we recognize the way that we describe these injuries, from a medical perspective and in the media, that influences the public's understanding of what gun violence is, and it then goes on to influence what interventions we do or do not, put into action, or what policies go into effect. So we need this information to better inform, how we go forward to confront this problem. And I think that violence intervention programs that focus a lot on the victim and the victim's families and their individual circumstances are extremely important. But I think that this study also kind of brings up the point that there needs to be a balance also and a focus on these communities and an investment in these communities that are so heavily affected by gun violence, because it's not. We can't say that it was some conflict that the child was involved in, that child needs to learn how to manage their anger better or something along those lines. Mm-hmm. It's a community level problem a lot of times, and we need to approach this at the community level as well, and balance that with the individual level interventions.
Mm-hmm. And speaking of community, we have a caller who is asking what it is we do know about the shooters. There's not that much in this study, but it'd be great to hear from somebody in the community. Ron, welcome to St. Louis on the Air.
Good afternoon. Yes, I think it's very important to focus in on the shooters or the murderers, because that's where the problem lies. And the reason I say that, I remember about 15 years ago, I read a report by the Black Sheriff Association that indicated that most homicides in the African-American community are committed by, say, about 75% of them didn't graduate from high school. 80% of them didn't have a father in the home growing up. And all those statistics kind of help paint a picture of how you get those individuals to become, unfortunately, in the criminal justice system. So my question is, what research was done to look at the profile, the social, economic, and the background history of the shooters?
Ron, thank you so much. Dr. Clukies, do you have any response to what Ron has been asking about?
Yeah, Ron, I think that's a really good point. And I think, oftentimes from the medical perspective, we're not privy to that information that law enforcement learns. It can take many months, sometimes even years later, to figure that stuff out. I know there's some studies that look at people who intentionally cause a mass shooting, and there's a long history, like you were mentioning, of trauma and not strong social support in childhood, and isolation and bullying and things like that. And so I completely agree with you, Ron, that is an area that needs to be targeted. And I think the most important thing to say is, right, there's not one answer, right? There's not going to be one law or one medicine or one program to fix this issue. It is so multifactorial, and I think this study truly shows that there needs to be an investment in the community on many, many different levels in order to target everyone who's involved: the shooter, the victim, the victim's siblings or family members who may not even witness the assault or the injury, but are affected by it. I mean, there's even data. One of our trauma registers, Amanda Truelove, published a study showing the trauma that the registrars, so they do the coding and the chart reviews. They have no personal interaction with these patients, but just from looking at the chart reviews day in and day out, the trauma that they suffer. So one injury definitely has a huge impact on so many levels. And I think the bottom line is that we need to start investing more to decrease community level violence.
We're going to pick up with that when we come back. Welcome back. Now, before the break, we were talking about the multiple impacts, the layers of impact that shootings have, including those who are keeping records and have no sort of personal contact with anyone who's described in the files that they deal with. In the past few years, we've seen levels of gun violence in St. Louis that's really hard to understand, even in numbers. And the Post-Dispatch, which tracks these cases, shows that at least 21 shootings this year involved children, and that included 9 who died. Last year, St. Louis Children's Hospital recorded 163 children were treated there for gunshot wounds, and that was a record that was set. Now, with that in mind, how are researchers and doctors supposed to confront gun violence as it rises? I mean, it seems like we know so little overall about how these incidents keep happening. Dr. Bernardin, what are your thoughts on that?
Well, I think, as I had said before, it's really astounding how little we know at this point, even though it's such an enormous problem, and has been for a long time. I think that, we're only, unfortunately, still at the beginning of even just describing what the problem is. So I think that there has to be an investment in more research that can continue to kind of, unfold this problem and help us understand it better.
And why is it? Why is it that there is this dearth of information?
Yeah, I think that one problem is like Dr. Clukies was saying, is we only have so much information to go off of right in the immediate presentation, from the emergency room side of things. And, this was a study that was conducted that spanned for several years, but the amount of digging through the medical record, trying to piece together what the story was from the victim's families, from other witnesses, from police that were present in the hospital, it's a little bit labor intensive, and that's why I think one of the many reasons why we don't have as much information as we would like. And I think we also have to acknowledge that there's been, legislation and things that have made it difficult to do large studies about gun violence, that have limited gun violence, research funding and things. But I do think that as we, as a nation, recognize the magnitude of this problem, I really hope that physicians and other researchers will step up and will do what they can to investigate this further, and then with that more informed kind of lens, can we go on to strategize better about how to confront this problem.
Dr. Clukies, do you know whether there are some resources that are available for those who want to study the circumstances around shootings that involve children?
Yeah, we, like Dr. Bernardin said, I think for a long time there wasn't federal funding for research, and so we're playing catch up right now. And I give a lot of credit to all the researchers out there who are, frantically trying to analyze and publish data so we can catch up to the rate of the firearm injury increase. There are different grants, and there started to be large-level grants, like through the American Academy of Pediatrics and through the CDC. And so they're coming out there. There are definitely more opportunities, but we're catching up. We're trying to understand, decades of data as we're trying to analyze it as quick as these numbers are increasing, so we know how to intervene. So I think it's just taken us some time, unfortunately.
So what are some of the obstacles then that exist? I mean, there's not much research, but it sounds like the study that you both were involved in, it was laborious, and that could not have been the labor of just a couple of people. I mean, what other sorts of resources would help to make this sort of research sustainable in the future?
I think that I can venture one idea, and that is that we need to have improvement to the way that we classify these injuries, and that's particularly in the medical coding system. Like we've said, we're kind of limited in the codes that we use currently. There are firearm assaults and there are unintentional firearm injuries. firearm injuries that are, of unknown cause, but there isn't any way to describe, a firearm injury that was the result of, being a mistaken target or an innocent bystander. Like, there's no code for that, unfortunately. If we could make improvements to that system, it would be significantly easier to analyze really large amounts of data, to see, in more than just, one hospital setting, across the country,
Right.
what is the frequency that these children are being injured, unintentionally? And there's just not any feasible way to do that right now.
So who or what governs what terms are used, which ones are added?
There is a coding system, it's called the International Classification of Diseases, or ICD codes, and they are upgraded every so often. But who's in control of that? That's a really great question. I wish I knew the answer to that. It's a very mysterious to me, and if I could find that out and make some suggestions, it would definitely be that we could describe better exactly what these injuries are, because obviously this is extremely frequent, and we could do much better.
Dr. Clukies, in 2021, you began leading BJC Healthcare's Gun Safety Intervention Program. And that's a program that provides free gun locks to families needing them. And that program is now expanding. Tell us about that and why these gun locks are important.
Yeah, thanks for asking about it. So we in the emergency department at St. Louis Children's Hospital, we see about 55,000 patients a year for a variety of things, for things like firearm injuries, like we mentioned, or broken bones, or coughs, or pneumonias. And we determined that, this large patient population would be a great way to screen people for firearm safety. And I think a lot of what stemmed our motivation was just the rise in numbers, like you mentioned, that we were seeing. In 2020, we saw 150 children shot by firearm injuries just at our hospital. And like you mentioned, in 2022, it was even higher, and it was a record for our hospital. And so we wanted to do something, and we wanted to act. And I think, it's not one answer to the firearm epidemic, but it's a small part that we can do in order to save the lives of children and to impact our community. And so we started screening every family who entered our emergency department about access to firearms. And we created a script that happens in triage, and we wanted to make sure that it was neutral and it was not judgmental, and we were really meeting each family where they were on this topic. And so we created a group of trauma nurses and physicians and community partners and social workers, and we came up with this script that just asked about firearms in a neutral way, so we could gather some data about our patients and if they have firearms and how they are stored. And then we basically just offered free gun locks and interventions. And we explained to the families, this is how you use this gun lock, and this is what you need to do in order to keep your child safe or anyone around you safe. And it was a huge success, more than we even imagined. And I think I give a lot of credit to the approach of the process, because we didn't get pushback. We didn't get families who were upset that we were talking about this sometimes, a sensitive topic. Mm-hmm. We had some really great conversations, and we normalized the conversation about firearm safety to really focus on safety and on prevention. Mm-hmm. And we ended up giving out thousands of gun locks just with that triage process. And at the same time, we did recognize that there may be some people who don't want to answer those questions, and that's totally fine. And so we added a gun lock basket that we called the No Questions Asked basket in our emergency department triage, where people, if they didn't want to talk about it, they could just take a free gun lock or two or however many they wanted. And we didn't have to ask them any questions. And that, again, was a huge success. And so, BJC as a hospital system really, really supported that initiative, and they've expanded that no questions asked basket to all of the BJC emergency departments in Missouri and Illinois. Mm-hmm. And I give them so much credit because, to my knowledge, it's the first hospital system to do to implement a project like that on a system level and to support such a important initiative.
Right. Well, it's great to hear that is an improvement or a step forward that's being made. Dr. Lindsay Clukies is an emergency medicine physician at St. Louis Children's Hospital and also an instructor of pediatrics and emergency medicine at Washington University. Dr. Mary Beth Bernardin is the lead researcher on the study we were just discussing and an assistant professor of clinical emergency medicine and pediatric emergency medicine at University of Missouri School of Medicine and also an instructor in pediatrics and emergency medicine at Washington University. Thank you both for talking with us.
Thank you so much for having me.
Thank you so much.
This episode was produced by Danny Wissentowski,
with audio engineering and podcast design by Aaron Dorr.
Our executive producer is Alex Hoyer.
St. Louis on the Air is a production of St. Louis Public Radio. Understanding starts here.
Our podcast proudly supports St. Louis artists by using music from Life Creative Group.
Do you find yourself regularly listening to episodes of St. Louis on the Air? Suggest us to a friend you think might enjoy our conversations. And leave us a review and rating on Apple Podcasts on the App Store. It's the simplest way to help people discover our show. Thank you.
St. Louis Public Radio is a member-supported service of the University of Missouri St. Louis.
Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.